This is Dr. Wayne McCarthy, and please make him welcome.
So, welcome everybody. And thank you, John Eisen, for making this venue available for me to share some of my thoughts about ozone therapy to you. I don't have any visual aids today, but I hope to paint a little picture for you. My name is Wayne McCarthy. I'm a naturopathic doctor. I was a naturopath in New Zealand. I went to South Pacific College of Natural Therapeutics and practiced as a naturopath in Auckland for about 5 years. Then I went to America, got married. And when I arrived in Hawaii, there were lots of people coming up to me and saying, "Are you a naturopath?" I said, "Yes." And they said, "We want treatment." And I said, "But I'm not licensed here." So I got an opportunity to go to medical school in Oregon, which I'm very grateful for. And I spent 3 years at medical school in Oregon because I already had a naturopathic diploma and many years of practice. As well as studying, I also got to teach a few courses there. While I was there, I met a man by the name of Dr. James Hutton. He was a couple of years ahead of me. He was an intern working with an old doctor up in Mist, Oregon, a man by the name of Dr. William Turska, who brought ozone to America back in the 30s, made his own ozone generators, and was seeing people from all over the United States in Oregon. After I graduated, I went to Hawaii and I practiced there for 15 years as what we know here as a GP, but over there we're called primary care doctors. So people would come to us, first in many cases, and we would refer on if we couldn't meet their needs. Because it was in a tropical climate and I'd trained in Oregon, I knew that I was going to need something that would help me treat tropical infections, and I was a bit concerned really because those tropical infections can get quite nasty quite quickly, and people cut themselves on coral, get infected with Staph aureus. Just because of the heat and the warmth, a lot of bacteria grow, so you get infections that can be quite difficult to treat. One of the first patients that I treated up in Harvey said to me, "I have an ozone generator here, would you be interested in it?" And I thought to myself, I might be. So they pulled it out, I had a look at it, I said, it hadn't been out of the case, it was brand new. I said, I'll take that. Then I called James and I said, "James, start teaching me how to use ozone therapy." And the first thing he said to me was, "It's not a panacea," which I've come to doubt that statement, but anyway, it's not a panacea, but it's pretty good for a lot of things. So I started ozonating olive oil and just giving it people to put on their skin. And what we found was it seemed to resolve most dermatological conditions. There's something called Howley rot, which are those little white blotches you get on your skin, and they don't heal or go away. Well, it seemed to resolve those pretty well. And one of the first patients I treated was a woman that had a port wine stain over her entire right cheek. I thought it was a birthmark. She seemed to think it wasn't, so she wanted treatment. So I gave her the ozone oil. I said, "Here, try that." Called her about 5-6 days later and said, how did you go? And she said, "Oh, the port stain mark has gone." And I thought, that's not possible. This woman's nuts. "Come in and let me have a look, will you please?" So she did, and sure enough, it had gone. Even I was impressed with that. Since then, we've used ozone oil for basically every orifice of the body apart from the eye, and certainly for skin conditions. What's good about it is ozone that's been bubbled through oil for a month. So it's heavily impregnated. Then when you place it on your skin, ozone will just dissolve into your skin over a period of hours. You can put it in your throat and all sorts, and it will clear up infection. Oxygen is nature's best antibiotic, and I've found in my career as a naturopathic doctor that not concerned about infections. I don't care how bad they look. The chances are ozone will take care of it. Most pathological organisms that cause infection in people are anaerobes, which means that they're primordial life forms that have adapted well to living without oxygen. They actually developed in Earth's history at a time when there wasn't much oxygen in the atmosphere, and so they learned how to create ATP from glucose anaerobically. And while that does provide some energy, it's a very poor source of energy. Your aerobic microbes, or the way that we're supposed to process energy in our bodies, is using oxygen, and we can create about 38 ATPs from a single glucose molecule. That's the way you want to do it, because it makes the most energy. So, yes?
ATP, is that adenosine triphosphate?
Adenosine triphosphate. Yeah, whenever you hear phosphate bonds, you always know you're talking about high energy bonds, and that's the currency that our metabolism uses for fuel. So ozone is a triangular molecule about the shape of a water molecule, but it's made with 3 oxygens, whereas O2 is a linear molecule made with 2 oxygens. The difference is, even though ozone is made from pure oxygen, the fact of its shape means that it will connect to different receptor sites in the body, and therefore can do things that oxygen cannot. So that's the first point I would make, is that ozone, even though it's made from oxygen, it can do things oxygen cannot. And it is the medicine. When we're making it, we use pure medical grade oxygen, no nitrogen in it. You've probably heard that ozone is a toxin, or can be very toxic. This is true, but only if it's mixed with nitrogen. And what you'll find is that it's a component of smog, and for that reason, if you breathe it, it's very damaging to your lung membranes. However, this ozone is actually there to clean up that smog. That's what it's doing. It's nature trying to get on top of the toxicity, and it'll use oxygen to do it. Whereas the ozone that we're using is in micro doses, 27 to 45 micrograms per mil, which is 27 thousandths of a gram, you know, very, very small amounts. And fundamentally what we're doing with ozone is we're saturating the body with oxygen. If you just think about that for a moment, what does it mean if you saturate your body with oxygen? Well, it'll do a number of things. One, you're going to get a really good circulation. Number 2, you're going to rid your body of most pathogenic bacteria or viruses. They have no defense against active oxygen. They have no antioxidants in their cell wall, whereas our healthy tissue does have antioxidants in the cell wall: vitamin C, vitamin E, zinc, selenium, superoxide dismutase, catalases. You know, we're quite endowed with antioxidant capacity. However, underlying most chronic illness is the fact that the oxygen capacity of the body has dropped, and the tissues are starting to go over into an anaerobic form of metabolism. This is where tumours and cancers can form. But even along with that, you're going to get inflammation, and chronic inflammation is what underlies all chronic illness. So that bears repeating, because underlying all chronic disease, you'll find there's inflammation in the body. And inflammation is chronic oxidative stress. It's chronic and it's oxidative stress. What that basically means is you've had electrons stripped out of your tissues. You've had electrons stripped out of them. So now there's an inflammatory response, and you can think of things like psoriasis, rheumatoid arthritis, chronic fatigue, the list goes on and on. You could pretty much open a medical dictionary, point to any disease, you'll find there's chronic oxidative stress underlying that. So as a naturopath, we were trained to seek out the cause of illness and to remove the obstacles of cure. So since I started using ozone, pretty much most of my other methods have gone on a back burner, and now pretty much I'm going to use ozone for everyone, for everything. First line of treatment is going to be ozone. And it's been a remarkable journey doing this. From the very early days, what we found was that most people, by the time they come to their naturopath, have already been to their other medical practitioners, often to the brightest specialists in the country. I'm talking America, but also New Zealand. People have been to the Mayo Clinic, one of the most prestigious medical clinics in America. And they would end up in my office in Hawaii. Even so, I would start ozone treatment, and even so, we would be successful most of the time. So I learned this very early on, and it developed a great deal of confidence through it. Now, that confidence I share with my patients because people these days seem to be suffering, I think, I don't know, in general, probably more than in the past, and very sick, very desperate, been around the traps, spent lots of money, and sometimes still haven't got resolution for their problem. Once we start to introduce ozone into the system, though, what you'll find is that you'll fire up that vital force, you'll fire up that spark of life, and you'll get the biooxidative system working again. Basically what happens is our mitochondria, their function starts to decay. Mitochondria use oxygen, but particularly electrons, to make energy. And when people have chronic fatigue or are chronically ill or just sick, their body's stripped of electrons, the oxygen levels have come down, and their biochemistry just isn't working. So you can take drugs, you can take herbal medicines, you can take supplements, you can take all the nutritional products that are good and should work, but sometimes you find that they just don't get the clinical effect you're looking for. And I believe it's because they're not being processed. That body is just too tired. It doesn't have the biooxidative capacity to actually break down those nutrients and use them. Once we start to give ozone, what we find is that the clinical picture tends to clear rather rapidly. The sicker a person is, the more dramatic will be the response. I'm just thinking of a chart that I saw in Velio Bocchi's book, which I'm just going to mention these as I go through. This one's Oxygen Ozone Therapy by Velio Bocchi. He's a world-renowned professor emeritus, Siena University Physiology Department. He's written the definitive guide, and all the current knowledge we have is written in this book. For those of a scientific bent, I think you'll find most of your questions will be answered if you read through that book. Basically, he has a little diagram that goes from health to disease, orthodox treatments, ozone therapy, death. And that's where ozone therapy shines, is when all other treatments have failed and you're either looking at dying or getting well. That's where we employ ozone, and if it's possible to recover, ozone can do it. So ozone was developed or first discovered by Christian Frederick Schonbein in 1840. He was a chemist. The early chemists that worked with ozone, they all died of emphysema. The reason is they didn't really know the gas they were working with, and it's dangerous to breathe the raw gas. What we've learned over the last 100 years, though, is that we can use it for breathing, but we've got to bubble it through oil first. And if we do that, it forms a terpene, which is a carbon-hydrogen structure with an O3 on the end. It makes it safe to inhale. So we use it for asthma, emphysema, bronchial infections, pleurisy, these kinds of things. And it is safe to breathe in very small doses like that. In general, ozone therapy has earned its reputation through working with circulatory diseases, circulatory problems, and infections. It was first used in 1915 in Germany to treat battlefield infections, gas gangrene, which is normally fatal. And half the limbs that normally would have been amputated were saved by injecting ozone directly into the femoral artery, which is about right here. And it would take the ozone gas down into the leg. It would resolve the gas gangrene, restore the circulation, and the legs would be saved. I personally have done this on a number of occasions. Not injecting into the artery, but just using ozone therapy. We've saved legs that were going to be amputated. And just recently, we had one woman up north. She had had one leg amputated. She had ulcers in the second leg. The toes were going black. She looked like losing that second leg. We started with ozone therapy and followed up with chelation therapy and also vitamin C drips, which, by the way, work very, very well together. So any kind of circulatory problem where blood's not getting to tissue, for example, after a heart attack or a stroke or diabetic neuropathy or for a blood clot or for whatever reason, if we ozonate the blood, what will happen is that the red cells become very slippery and they're able to twist and turn and get into those very small capillaries. For example, in the back of the eye, in the retina, you've got the smallest capillaries in the body, and ozone therapy is the treatment of choice around the world for macular degeneration, the dry form, not the wet form, but in general, very good for eye disorders. Part of the reason is that the serum, as well as the red blood cells, which normally the red blood cells carry your oxygen. When we ozonate the blood, yes, your red cells carry actually more oxygen and deliver more oxygen more easily to your tissues. That's why they get saturated and produce a sense of well-being. But also the serum gets oxygenated. So even if blood cells can't get through to tissue, the serum might. And because it's got ozone in it, it will keep those cells alive until we can actually restore a good circulation. So even in an emergency situation, ozone can save tissue from going necrotic. It's also used in anti-aging medicine, I suppose, for obvious reasons there. So I'll just come back to my initial premise that underlying all chronic illness is the chronic oxidative stress. Ozone is an oxidant, and doctors usually will argue that if something's an oxidant and you put it into somebody with chronic oxidative stress, you're just going to cause them harm. And logically, that's true. However, in fact, it's not true. What happens, because we're using such minute doses, we put in an acute oxidative stress, which helps the body upregulates its antioxidant capacity. So think about that. Even though ozone is an oxidant, the net result of using it is that it will raise up the antioxidant capacity in the body, which, by the way, might not have been working up until now because of the chronic oxidative stress. The next treatment, we increase the dose of ozone, which raises up the antioxidant capacity even higher and scavenges free radicals from out of the body. I'm sure you've all heard of free radicals because it's the theory of what underlies illness and aging. Ozone doesn't create free radicals in the blood because in the pH of the blood radicals can't be formed, and also ozone reacts primarily with polyunsaturated fatty acids. That's its primary target, and that will be probably a red blood cell membrane or the lining of the vein when it's introduced into the body. So we overcome the chronic oxidative stress, blow the cobwebs out of the biooxidative pathways, restore the enzymatic function, which means now our bodies can utilize oxygen to good effect. Well, you've just overcome most serious illness, or helped, or very much started along that path. So that's the basic theory behind it. I've been doing ozone treatments now for 25 years. Oxygen is the most vital nutrient for optimum health. We know that we're made up of 70% water. Well, water is mostly oxygen. And the actual weight of oxygen in our body is probably 70 or 80%, whatever it is. The point to take home here, I think, is that in every step of every chemical reaction, oxygen is needed. So in every step of every chemical reaction in our body, oxygen is needed, basically because it'll either give or donate an electron. Now I'm being asked about other methods of applying ozone apart from the oil. Yes. Is everyone familiar how it's applied? Okay. I'm doing blood work, so I'm bringing blood out of your body, I'm mixing it with ozone, and I'm reinfusing it. Or else I'm taking blood out, I'm shaking it up with ozone, I'm killing any bacteria in it, and re-injecting it into a muscle. This is a vaccine made with your own blood. It's got no adjuvants in it. Very good for autoimmune problems. You can get into a sauna and have the steam ozonated, and it will clean the lymphatic fluid under your skin. Very excellent treatment, that one. You can insufflate it into the colon or the vagina or into the ears. Insufflation means filling a volume with a gas without creating pressure. So it's not like you're blowing up a balloon, but you're just, filling a glass with oxygen or ozone, and it's just inside there, not creating any pressure, but it will be absorbed. For example, vaginal infections, candida, herpes, endometriosis, all kinds of gynecological problems. The ozone gas can be just administered directly, and it will have an almost instant effect. For bowel complaints, Crohn's disease, inflammatory bowel disease, fistulas, many other types of problems, we can put ozone into the colon. Otherwise, we can use a stethoscope and just put it into the ear, and because you have a lot of blood vessels and capillaries in the ear canal, you actually will absorb enough oxygen to raise your blood level. Those are the main ways it's used. I find it a very versatile, ozone is very versatile for me. I inject it into muscles, I inject it into joints, I've injected it everywhere in the human body, pretty much, other than the eye. I won't go there.
So if a person has osteoarthritic knees, what would you do? This is secondary.
Osteoarthritis in the knee. The osteoarthritis that may not be causing the pain. Sit on that one for a moment, because if you've been told you've got osteoarthritis and you've got joint pain, you'll probably be thinking the osteoarthritis is causing it. But we know that it's not always. In fact, it most often isn't. We just inject ozone into the knee. It takes away a lot of knee pain really quickly. Sometimes instantly, sometimes it might take a week. But it reduces inflammation, and it brings more blood to that joint. Joints generally have a poor blood supply, and that's why the cartilage and the ligaments don't heal very well. Whereas if I inject 5 or 10 cc of ozone into a knee joint, It will stimulate cartilage regrowth, but also bring oxygen and oxygen and blood to that joint. I inject it into pain, because wherever there's pain in the body, or if you have any pain in your body, you have low oxygen in that area. So what is pain? Pain is hypoxia. How do we know this? We'll inject ozone, the pain will go most often. So I've found it very useful for very chronic or serious or acute painful conditions. And as a doctor, it's really nice to have something that you can use for that that's really rapid. Gains the confidence of the patient and gives them hope that they can actually recover. Yes? Oh, 6 treatments is what you need. You need 6 ozone treatments. They're $210 each, so it's $1,260 to get 6 ozone treatments. It'll be the best money you ever spend if you're sick.
How do you use it for metabolism?
Remember to restate the questions.
You're asking me about metabolism?
How do you use it for metabolism?
She's asking me, how do I use ozone for metabolism? Basically, the reason your metabolism is slowed down is because there's not enough oxygen in the system. You've got what we call dysoxygenosis, or dysfunctional oxygen metabolism. Basically, the respiratory enzymes have been toxified through chemical pollution, pesticides and so on in food, additives in food, vaccination, poor breathing, anger is a big one. Robs the body of oxygen. As I said, every step of every chemical reaction requires oxygen. So when your oxygen starts to drop, you're not going to have a good metabolism. When you restore that oxygen capacity and your body's ability to actually process oxygen, something called respiration, essentially. What's that? Thank you. It will kickstart the metabolism.
But how do you use it? I mean, is it oral or just injection?
No, it's always, she's asking me how it's used, but it's always used with treating the blood.
Can you put it into water?
Yes, you can ozonate water and drink it. People have home units where they treat water and drink it, or they can insufflate themselves, or they can do steam saunas at home. There are these methods available, and a lot of people are using them.
Does it affect the good bacteria?
No, it doesn't affect the good bacteria. They're usually aerobic, and they will do just fine. It's the anaerobes that are out of control that are causing the problem, and ozone is murder on those.
It's kind of like the Vatican. Those who are anaerobe are in control.
Very good. Ozone is safe. There have been 10 million treatments analysed in Germany with a meta-analysis. The adverse reaction rate was 0.00007. Ozone is safer than vitamin C, despite what some medical authorities might try to tell you. So the adverse reactions are generally a transient skin flush or complete blindness in both eyes for about 1 or 2 minutes. And that can be quite scary. I have had it happen about 3 or 4 times, but it's only very, very temporary. Otherwise, there are no negative side effects to ozone therapy. You're not taking any risk when you do ozone therapy. It's safer than vitamin C, which we love, by the way.
And vitamin C has no known toxic dose.
That's right, vitamin C has no known toxic dose.
What kind of age group? Can you work with little babies as well as the elderly?
Yes. If I'm going to work with children, I do insufflation of the colon or just ozone oil on their skin. Kids and animals respond really well to some ozone into their bottom. It goes into their colon, gets absorbed and goes up through the portal vein into the liver, helps detoxify the liver. Very good for hepatitis. and kids respond very well to that. I treat people up into their 90s, and at one point, 85% of my practice was people over 90, this is how it goes. There was about 90% of my practice was people over 85. At that point, we weren't really thinking we were going to have a very long career. But they loved us.
But you added to their age.
They loved us because as you get older, your enzymes levels go down and you just can't process. When you have ozone, you'll kickstart that metabolism. It will come back. You will feel younger and happier and healthier. And what we used to hear most, the feedback we got was, "Doctor, I'm feeling an overwhelming sense of well-being." I could mention a few cases. Would that be interesting? Okay, one of the first things I learned was when I would go from Hawaii to Los Angeles and do week-long treatments in the clinic over there. I would treat people every day for a week by taking out a pint of blood, ozonating it and back in, and we'd do it every day for a week. At the end of that time, we got the feedback, and we stayed in touch and got feedback as the months went by. One of the first things I realised was that everyone seemed to benefit, and there were some real miracles that came through. Can't guarantee that, but we do get our share. The first thing I noticed was genital herpes, or any kind of herpetic infection, is one of the easiest ones to treat with ozone therapy of all the viruses. So there was a lot of happy people that were not having herpetic outbreaks anymore. And apart from improving in health, it also improved their social life tremendously. There are not many good medicines out there for viral infections. There's quite a few antivirals, but in any system where you find there's a lot of a medicine for one thing, it tells you that they don't work very well. That's why there's so many of them. Whereas ozone will work very well on viruses. The reason being, the viruses have what's called a capsid. It's not a dual layer of cholesterol or fats. It's a thinner capsid, and it has no antioxidants in that capsid. So once ozone touches a virus, it will kill it. It'll attack its double bonds, it'll break open, the guts will bleed out, and that virus will die. So very effective on viruses. I treated a woman yesterday who came back from Rarotonga, and she had blood in the urine and kidney pain. We didn't know what was the cause of it. It had been cultured, but we hadn't got anything back yet. I started administering ozone, and she had a Herxheimer reaction within 5 cc, like within the first 10 seconds of the treatment. She started to say, "I think I'm going to faint." This is called a Herxheimer reaction, and it's because a virus is dying off. So that's how we know. Anyway, the point is, patient virtually fainted for a couple of seconds. I raised the legs, blood went to her head, she came to, as they do. It's quite safe. But a day or two later I called her and her problem had resolved. This is typical of viral infections, by the way. Yes?
What's the experience with HIV and AIDS?
I'm being asked about AIDS with HIV. There's plenty of material on the internet there, but we believe HIV is resolvable, is curable with ozone, and that's well documented. So if you go and research that, I think you'll find it's pretty clear. I've treated a few people with HIV and got them off AZT, and their immune systems remained quite low, but they didn't get any infections. Yes?
I interviewed a guy who said that about 70% of people would test positive for HIV. It doesn't actually really mean anything.
We don't believe HIV is the cause of AIDS. It's a very weak virus that does kill T cells, but the rate your body creates T cells, HIV just would have no chance of annihilating them.
Well, as long as it doesn't kill my coffee cells.
That's right. Hepatitis is very amenable to ozone therapy, as is chronic fatigue. In hepatitis, you get raised liver enzymes because the liver is working very hard to detoxify, and it's starting to bleed out enzymes into the blood, and you pick up the ALT, AST, or GGT, the transaminases. Once we administer ozone therapy, those enzyme levels drop rather quickly, and the inflammation in the liver goes down. And I've personally treated many cases of hepatitis, mostly hepatitis C, and some have resolved and the people have gone negative. But in every case, the health improved, and we brought them into a zone where they were less at risk for liver cancer going forward. So in every case of hepatitis, ozone should be one of the first treatments that I think should be looked at. Cancer. That's a big subject there. We don't claim to have a cure for cancer, but what we do know is that the primary cause of cancer is a 40% drop of oxygen levels in the body. By the way, we measure everyone that comes into our clinic with a pulse oximeter to find out what their blood oxygen levels are. But in cancers, the blood levels drop, the enzymatic pathways are intoxicated, and so the cells start to go on to anaerobic metabolism, which means they can't really do anything useful except divide. So they do that and tumours are formed. We inject directly into the tumours with ozone. Can't claim to have a cure for that. However, everybody is helped, and we do have cases that resolve. You know, we have our miracles, and we have just people that are vastly helped. I treated a man 6 months ago who had multiple myeloma, which is a bone cancer, and it's got punched out lesions in the bone, like someone's taken a paper punch and just punched holes in the bones, usually in the flat bones of the skull and the hip. And his paraproteins, which are the markers of that cancer, were just going up like that. He was told he had only a few months to live. From the time I started treating with ozone, even after the first 1 or 2 treatments, all his pain left, and his paraproteins dropped right down to normal and have remained there. That is a miracle, I grant you. I don't take full responsibility for it. But it is a success that we have had, and we treat a lot of people with cancers, and they all tell me that of all the treatments they had, they often tell me ozone did me the most good. Also, if you're doing chemotherapy or radiation, ozone will make chemotherapy and radiation 10 times more effective. It'll make aspirin 100 times more effective. But if you have to have chemo or radiation and you take ozone as well, your chemotherapy will be 10 times more effective. This is the German statistics I'm quoting to you here. It's on record. Yes?
Was there a fairly recent article on Walter Mouse with the iodine, with the cancer, from Candida, because you're running parallel around there?
Yes.
Can you just talk any more about how that's parallel? Or?
I'm asking about about iodine and parallels with ozone. Iodine is going to stimulate your metabolism. It's what gives you your metabolic fire. It creates the heat in your body. That's what ozone will do as well. So if somebody's low on thyroxine, I will give ozone, and that will often normalise the thyroid function. In general, you'll find ozone will normalise organ function. So thank you for your attention. I have tried to give you a bit of an overview of how ozone therapy works, how it's...
I have one more question.
Yes?
How do you deliver the ozone?
No, I've already been asked that question, how I deliver the ozone. That's fine. I'll answer the question. I'm going to put a needle in your arm and I'm going to draw blood out. I'm going to mix it with ozone and reinfuse it back into your arm. That's how I will do it. Then I'll take some blood out, mix it with ozone and re-inject it into a muscle. So I'm always using needles. So if you don't like needles or you're afraid of needles, then be very afraid if you come to me. But what you have to realise is everything you really want is on the other side of your fear. Yes, I've had lots of experience with multiple sclerosis. While I don't think it's curative, the patient's ability to perform daily activities, strength and endurance increases. With multiple sclerosis, I'll treat with ozone, but I'm also going to start looking for mercury and other heavy metals. I'm going to screen for those and chelate those out if they're needed. Well, thank you for your attention, and I hope that was of some value. And I will just end on a quote by Velio Bocchi, and Velio Bocchi's book is called Ozone, a New Medical Drug. So the naturopaths are holding on to it at the moment. It's alternative medicine, but really it started in the medical field, and hopefully it could end up there as well as things change. But I'll just quote Bocchi, and I echo this sentiment. I will be very gratified if during my lifetime I see the introduction of ozone therapy into public hospitals around the world. Thank you very much for your attention. Hope you enjoy your day here today.
Thanks so much. Yeah. Yeah. Good. Thank you.